the reality. But if we introduce lot of hospital, I hope that if the investment for the clinical engineering department 2%, obviously after 2 or 3 years, the outcome of the equipment, it will be enhanced 100%, 90%, 80%. This is my analysis. Another, patient satisfaction, tremendous. Sometimes I was conducted bypass surgery and standing, National Institute of Cardiovascular Disease, and sometimes a catheterization. I see that when a patient smiling their face, then they are very much happy. A lot of whom I receive, they bless to Almighty Lord. They bless to Almighty Lord, and patient is laughing loudly and more satisfied. And I keep the data with engineers, without engineers, in which hospitals like us operate the equipment, preventive maintenance, corrective maintenance, regular maintenance, scheduled maintenance, make a plan PPM, and technological life cycle, technology assessment, their impact is very, very tremendous and results. Example, National Institute of Neuroscience diseases, and you see the results, other specialized institution, every day huge income, that is not income, this revenue, subsidized revenue. So to the best of my knowledge, I analyzed the data, MRI, CT scan, radiology, ultrasound and pathological. Last month, they invested 0.2 million reason, and they returned back 1 million US dollar. It is a little bit, but patient flow is huge. So our people, lower income countries people, always mentally angry, annoyed. His result is good, this result is good, machine is reliable, no engineers, how to calculate. So it is the sudden, simple or 10 passenger in our country or 20 country region, or like other aircraft, make a lot of certain licensed engineer, whereas near about 500 hospitals, patients hospitals, 5,000 patient hospitals, 125 team of biomedical engineers, but there is little bit. So in this year we introduced some biomedical equipment technician. We are conducting training, enhancing their skill, literacy, testing tools and electronics and mechanical. We hope Bangladesh will develop and impact will be good from our side. So in this year I am going to be retired, but I am not retired. Thanks to my patience lecture. Any question? Anybody? Please feel ask to me, because my son is
lower resource countries, we have seen and case study that some machines lifetime is 20 years or 25 years, more than 25 years sometimes. What is the impact in this way? What is the impact on the patient?
Okay, I understand your question. Medical equipment are some categorized. Some are measurement equipments or the physiological parameter diagnostic. Say radiology or analytical equipment, gas analyzer, ECG. And some are therapeutic or life recovery. And some are conventional equipment sterilization. Those equipment has been used sensor, computerized technology, electronic devices, they have certain time life of span. But mechanical device has also lifetime. Usually we collect the data. You can use a autoclave, conventional autoclave, 10 to 15 years, it is metals. When the metals tempered, loss, and there is incident, so you can use the conventional equipment like autoclave, HEPA filter, or other mechanical devices, say OT light, OT table, you can use according to country perspectives. It depends on the research. What is the recurring cost? What is the spend? Depend on the investment or return. Example, my income monthly near about $3,000 or $5,000. If I feel sick, then my family will give more money for my treatment, and even they transfer from Bangladesh to Singapore because they know the return on investment of my father is high. If the return on the investment of the equipment is good, then you can take care. Need to engineering analysis. Understand?
Thank you. I just want to echo something that we started out talking about. You know, we're spending too much money on healthcare, and reality is there's 30% waste in healthcare globally. It means that those activities are not optimized to patient outcomes. And when we talk about what you just shared, the value a CE brings to an enterprise, and this is the food for thought, right? Technology, digital health done correctly is an investment. Done incorrectly is a cost. So as we all look to improve access to healthcare, improve efficiency, I think all of us have to be asking the question, what is it that we need to spend the money on, and where can we actually avoid the expense so that we don't make those expensive errors? I do want to call on our Japanese delegation, see Keiko or others from the Japanese CE Society would like to come up. I'd like to open the floor up for questions. I think we have about 10 minutes left, so we could certainly entertain questions from the floor, and I think we have a question. Would Keiko or somebody would like to come up? We have a mic. Yeah, we'll take a question. We're going to open the floor up for questions.
Okay.
If you have any comments, feel free.
Yeah, I have a comment about MANCH and about the digital health system at home. Yeah, nowadays we realize prevention and home care treatment is important. But before we didn't realize. But now about the financial issue, most of the countries, even developed countries, have a big issue about finance because already he mentioned, it costs a lot for healthcare. So my question about you is, can we reduce the financial cost when we focus prevention and home care treatment?
Yeah. So I think the question you're asking is, if we shift care to home, can we reduce the costs? And I think the way I would answer is that by improving cost and cost efficiency, we will give more people access to healthcare. So the ultimate challenge we have is 3 billion people lack access to healthcare. And I would even venture to say that even in the developed countries, many people, if not most, don't get to see the doctor right? So if you go to a restaurant and you're hungry today and you say, I'd like to order this, they say come back next week. Or they'll say go to this place for your salad and this place for your dessert, we would never go back. This is common in healthcare, right? So I think the biggest way we need to look at this is that we have a limited amount of money. And we have to do a better job of spending that money. So yes, there'll be savings, but that savings needs to be appropriated for things that really are important to us as patients and us as consumers of healthcare.
So I have one solution like that. The question from Japan is good. When we design and every year doing the budget, without paracetamol, Cefradin and saline, we cannot lead our life. So medicine is food supplement of our body, like machines. When we procure machine, then we have make a plan, because patients give us the revenue. So we need to estimate during procure the equipment. Example, I have made to plan for my children. I need to plan how to educate it, how to learn. So we can need to consider equipments as children. Newborn need to technology selection, and then installation and budgeting and installation, commissioning and planning of preventive maintenance, corrective maintenance and contracted price during the tender. Such price this. and I can call to the local vendors every time is okay. And in-house is cleaning, disinfection, conducting work order, and giving the bill. That's money. More of the countries, no problem. Because in this year, Bangladesh government provided huge budget. But due to lack of the sense of our engineers, shortage of our engineers, we cannot router it. So last year, government gave a huge budget. We spent only 37%. But due to lack of skilled clinical engineers and procurement methodology as well as all identification, technical specification and contract management, we have only used 37% money of the total budget. So country to country it will be, some countries no need spare parts. But if you ensure the preventive maintenance, I know the battery of the ECG machine after 2 years downtime. So I have a logbook. One battery is not more than $5. Tap, I think, no problem. And I do disposable, okay, no problem. So all disposable and consumable items like medicine, why medical equipment will goes to the breakdown or failure? I have a car, my son is telling that. I do the everyday preventive maintenance, calibration, fueling, mobiling and everything. If we can fly the aircraft, no problem, rail station, no problem, bus, no problem, my car is no problem, my family is no problem, why is problem in the hospital? This is the consideration from humanities, mentality into fitness and realized by our brain. Thank you very much.
Thank you.
Are you happy?
Yeah. No, I just said we thank you very much. Yeah. I think we have time for one more question.
Anybody?
If anybody has another question.
Sir, please. Anybody?
Do we have? Yeah, I think we had a question here and I want to make sure we.
Thank you, sir. Very nice presentation.
The mic working?
Hello. Very nice, sir. Excellent presentation. Sir, actually, I don't know what is the clinical engineering or how does it comes medical disposable surgical devices. It can be applied on medical devices or not. And if applied, what is the usage?
Okay. Understand what is saying? Again, repeat the question, need to understand.
Sir, I don't know about clinical engineering. So I would like to know that medical surgical devices can be applied.
So I think you're asking